Good day, YouTube. How's everybody doing? Well, I'm back at you with another video. This is Carmelita, Belita's World, and we're going to be discussing Medicare today. We have already gone over retirement. You can look at the other videos in my category, and you will see part 1, 2, and 3. We did survivor benefits. We did retirement age of 62. And we did, we talked about full retirement age as well. And we talked about children's receiving benefits on the parents' records and things of that nature. You can look at the other videos and it'll give you all the great information. Now, with Medicare, Medicare is when a person turns 65 or Social Security have found you to be disabled for 12 months or more, and after 24 months, you're automatically entitled to Medicare. You can also get Medicare because of Lou Gehrig's disease and kidney renal failure. So there's other instances where a person may be entitled to Medicare, not depending on the age, based on being on dialysis, like I said, and I'm not mistaken, Lou Gehrig's disease is the other one. Now, Medicare is something that most seniors, once they turn 65, they can get. Anyone can get it if you're a U.S. citizen or a legal resident, been here paying in the system for at least 5 years or more. The thing I want you to really know about Medicare, because you will never know if you qualify unless you contact, because as with all the other, everybody is different. And every situation is different. Although all Americans are entitled to Medicare, if you didn't work and pay into the system, you have to pay for Part A as well as Part B. Medicare Part B, everybody pays for it. Some people get assistance from the state, the county, the government, and they'll cover their cost of Medicare Part B. Medicare Part A, if you work 10 years or more paying in it, it's free to you. You don't have to pay a premium on that. What I want you to really know is there's a time frame. Now, when a person turns 65, you have a certain time frame. You have so many months that you have to apply before any penalties start setting in. And what I mean, sorry, you guys, what I mean by that, Medicare charges 10% for every year you go without your Medicare. So say, for instance, I'm 65 in January. Well, I have 3 months to file for my Medicare prior to age 65. And I have up to 3 months past age 65 to file. If I do not file within that time frame, if I'm out of what is called the initial enrollment period, then I cannot even file until, if I'm not covered with a group health plan through a current employer, either my employer or my husband's employer, then that means I have to file in January, February, or March of the following year. Okay? And if a whole year goes by, then I have to pay, before I enroll, then I have to pay that 10% on top of whatever the going rate is. So it was 170.60, I think, for 2022. Medicare dropped down to 163, I think, 40 for 2023. The main thing you all need to worry about is when you're turning 65, if you're not still working and covered through a current employer or your husband's current employer, you need to contact us. If you're self-employed, it gets a little tricky. Now, with self-employed people, it's dependent on how many employees you have, whether or not you should file or not. Because if you got less than 100 employees, guess what? You need to file for Medicare. Excuse me, you guys. You need to file for Medicare. Otherwise, you're going to have to pay a penalty. Self-employed people, look at this forehead. Sorry, guys. I got distracted by my own head. Self-employed people, it's a little more, the rules is a little more stricter. I don't get it, but, even though you're self-employed and you may be paying for Kaiser, a plan for you and your family, if you turn 65, you have to come on. If you don't come on, it's 10% once again for every year you go without it. And most people be like, well, I pay for, I'm on my TRICARE with military. Well, guess what? Some years back, they changed. You have to have Medicare Part A and B, even with that. So it's a lot to it. You need to call 1-800-772-1213 to make sure you do not give up Medicare without knowing all the ins and outs to it. So everybody's situation is different, like I stated early on, when it comes to receiving these benefits. You may be working and you terminate, you say, oh, I don't want Medicare right now because I'm covered with my current employer. So I work for Walmart. Walmart has coverage. Well, you don't have to take it. But remember, when you get ready to retire, you need to contact us. Because from the date you stop working, whether that be retired or quitting the job or whatever, from the date you stop working, you have 8 consecutive months. Within those 8 consecutive months, you must file for Medicare in order to avoid the penalty. Now, the great thing about this is because you are working and covered through employer, you can choose the month you want to come on. All right. So I'll give you an example. You're married and you're working and your spouse turned 65 and they're on your medical coverage. So they refuse Medicare right now because they're covered through your insurance. Well, what happens is when you retire, now your spouse needs to come on to Medicare, or when you stop working, even if you lost your job, your spouse now needs to come on to Medicare. And what we'll do is we'll send forms to you for your human resource department to complete. And what they'll do is they'll put in there the month and year your health insurance started. Okay. So that way they'll see that your spouse was covered when they turned 65, and that'll keep them from being penalized, and they can choose the month they want to come on. I'll give you another example. So it's January. They're choosing, you stop working, but you're going to have coverage with your employer through April. Well, if it's beneficial for you guys, your spouse can say, come on in May. He can fill out the paperwork and say, hey, I want to come on under special enrollment in May because my wife was covered through her current employer. She stopped working in January, but our coverage is good through April, so I want to come on in May. They can do that. Okay. But you have to contact Social Security, get the forms, which is a CMS L564 for the employer to fill out. And you will fill out a CMS 40B. That form is for you to put in there the month you would like to start receiving your Medicare Part B. Okay? And once again, I'm going to go back to this. If you have certain medical conditions, you may be entitled to Medicare, okay? Dialysis, Lou Gehrig's disease. There are certain realms where you can get medical. If you have a disabled adult child and they are entitled to benefits on your Social Security record as a disabled adult child, they are also entitled to Medicare. And when you're already on the rolls, we will automatically send you the Medicare card and you will be automatically enrolled in the Medicare. So that goes for anyone. If you took your retirement benefits at 62 or 63, when you turn 65, you're automatically enrolled in Medicare. There's nothing for you to do other than taking your Medicare, signing it over to a HMO or PPO or getting a prescription drug coverage with it. Now, that's something else you have to think about is prescription drug coverage. If you don't have Part D, prescription drug coverage through Walmart or CVS, Walgreens, Kaiser, Blue Cross, Blue Shields, whatever insurance you're going to go to, make sure that they have a prescription drug coverage. If they don't, you need to sign up for one because you also have to pay a penalty if you don't have prescription drug coverage. After so much time has elapsed, they will charge you a penalty for going without prescription drug coverage. So it's best to contact Social Security if you're not on the rolls, if you're not working, and you have no coverage through your spouse or anything. Just call us, call Social Security. I'm sorry. I keep forgetting I'm retired now. But call them and they will let you know. If you have any questions, hey, hit me up in the comments field. Leave a question and I will respond to questions and do my best to try and assist you. Like I said, I have 35 years, 5 months. And this was my specialty. This is what I did for a living for 35 years, 5 months. So I worked for Social Security Administration all over the agency. So I do know a lot about how things work and ways to make it easier transition for you as you get to the point to where you may need these benefits. All right. Let's see. At the end of the clip, I'm going to give you some information. I'm going to add it in the clip at the end regarding Medicare and prescription drug coverage. You can go to Medicare.gov and read up on it and apply for Medicare through SSA.gov. But and you can just state that you want Medicare only if you only want Medicare because you're still working and Medicare is going to be cheaper than what you have. Some people come to Medicare because it's cheaper than what their job offers. Based on your income, your household income will determine how much you're going to pay for Medicare Part B. As long as you worked and paid into it, Part A is free to you. If you are filing for Medicare, there's so many different programs out there. Like one thing I know, Kaiser, not only Kaiser's different in pretty much all the different states. In California, you have Kaiser and you can sign up for their Senior Advantage program. They also have a Senior Advantage program here in Georgia. In Georgia with Kaiser, they also give you a food voucher for healthy foods. They give you, when you sign your Medicare over to Kaiser, you get Delta Dental on top of prescription drug coverage, and I know someone who has 0 deductibles for their prescription drugs, so they get their prescription drugs for free, and they get $150 for 3 months, every 3 months, toward food, and all they have to pay out of pocket for the program, the senior program, is $9 a month. So on top of their Medicare premium, which right now is $170, they pay an extra $9 to Kaiser. But look at all the benefits they get. They got full health coverage, and then they get a kickback of $150 for 3 months in a card, in a little debit card that they can use toward foods at certain stores like Kroger, Walmart. There's certain stores that card will work with, which is great. So yeah, do your research once you become entitled to Medicare. And sometimes it's cheaper than dealing with your own, especially if you're a senior self-employed person. Some self-employed people are paying $1,800 a month, $1,500 a month on medical insurance. Well, you will never pay that amount with Medicare. Even if you make a high income, I think the most you wind up paying is like $500 and something a month for Medicare, which is $1,000 cheaper than $1,500 a month. So that's something you all need to look into. Once again, you have a certain time frame that you can file for Medicare. You have your initial enrollment period, which is 3 months before your birthday to 3 months after your birthday. When you sign up doing those, you will not have any penalties, okay? When you sign up after your birthday, the month of or the month after your birthday, determines on when you can come on the rolls. So if you do it the month of, you are entitled to Medicare Part B the following month. If you do it the month after your birthday, it's the month after the month. Then you'll be entitled to Medicare Part B, but you will be entitled to hospitalization, which is Part A, your birthday month. So it's a lot to look at. It's a lot to think about. But this is just giving you some heads up, letting you know if you are getting close to retirement age, or you have kidney disease and you need dialysis, need to go on dialysis, or certain other diseases like Lou Gehrig's disease, you need to contact Social Security and see about doing an application so you can get Medicare. All right. So once again, you have that initial enrollment period, 3 months before, 3 months after. You have what's called the general enrollment period. That's once you have missed. You're not covered through no employer or anything like that. You don't have any medical coverage and you forgot, or you didn't pay your premium and they terminated you. Well, now you can't come on until the general enrollment period. You enroll, you have to file for it in the general enrollment period. You can only file January, February, or March. You got to the end of March to file. If you are beyond 65 or have had Medicare and it lapsed, for once it's passed over 30 days, you have to file during the general enrollment period if you do not have any other coverage through a current employer. So if you wind up one of those people who have to file in the general enrollment period, remember, you have to do your application between January, February, and March. However, you will not be entitled, if you come on in the general enrollment period, you will not have Medicare Part B until July of that year. Okay? So if you file in January 23, February 23, you have all the way to March of 23. if you miss your initial enrollment period and you're not covered through a group health plan, or you know went years and never filed for Medicare and you're not covered with a job or anything, or a spousal job, you can only file the application January, February, or March, and the Medicare Part B will start in July. Medicare Part A for hospitalization, that is retroactive back 6 months. You can get that, okay? But Part B, you will not be entitled to it to July of that year if you come on in the general enrollment period. I know this is a lot, but this is just a eye-opening, awakening for you to get up and do your due diligence to contact Social Security, okay? If you have any doubts or any concerns about what I'm saying. And then we have what is called the special enrollment. Once again, the special enrollment period, that is for people who are covered through their current employer or their spouse's current employer. These people can come on at any time. They can come on while the person is still working. If they choose, hey, you know what? I now want my Medicare. I don't want, I want to go on and join my Medicare, start my Medicare, and I'm going to drop my current employer insurance. They can do that. So they can join while they're still working, or they can join when they stop working. But they have to remember, they have up to 8 consecutive months from the last day of employment to file under the special enrollment. Okay? And they will be covered whether they're covered with their husband's, wife's insurance who's currently working, or if the person themselves is currently working, as long as they're covered. All right? And if you take care of your parents and you do more than 50% of your parents, and your parents need Medicare and you're already on the rolls, and you now take care of your parents and they're getting benefits off your record, they will also be entitled to Medicare. Okay? All righty. I'm going to go for now. Hopefully I did not overwhelm you. I don't like giving you too much when it comes to Social Security. If you have questions, please leave a comment below and I will try and get back to you. Go to Medicare.gov. This segment was strictly about Medicare. And once again, there's 3 enrollments periods that apply to Medicare. That's the initial enrollment, general enrollment, and special enrollment periods. I hope you all have a wonderful day. If this is your first time contacting me or watching my videos, please subscribe to my channel and hit that little bell button so you'll be notified every time I upload a video. And if you are a repeat customer, please share my videos and share my videos with all your friends and family. You guys, I'm a little tired, as you can tell. Look at these eyes. But let me get back on track. So if you're a repeat customer, please continue to follow me, watch my videos. Please continue to share my videos. I love you all, and I wish everyone nothing but the best. And as always, peace, love, and happiness is the only way to live. All right? So make sure you hit that bell button so you can be notified every time I upload a new video. And share my videos. This is very important. A lot of people are retirement age or due benefits, and they just don't know where to get started. All right? So, with that being said, have a good one. Don't forget to subscribe and follow me. Bye for now. And I will be uploading some documents from the Medicare.gov site. Just going to show you a little bit where you can do a little reading yourself. Bye for now.